Hi, I'm Tom Pettengill, a therapeutic body worker in Berkeley, California. And today I want to talk about a little known technique called muscle energy technique, or what's abbreviated MET. METs help to unwind subconscious holding patterns that can happen in our bodies. For instance, if I'm typing on the keyboard and I don't need to have my shoulders raised, the body over a period of time will create a subconscious holding pattern out of that. And the muscle energy technique will help to override that pattern. The way it works is actually very fascinating. When a muscle is in a isometric contraction would be like if I'm pushing down on my shoulder, but I'm also resisting that downward motion by pushing upward. That creates a isometric contraction of the muscle where it's not lengthening or shortening. So the technique is to hold that for 10 seconds and then relax. And what happens is when the signal from that muscle goes up to the brain recognizes it as a conscious isometric contraction, sends a message back down to that muscle, turns off the gamma neurons, and allows the muscle to lengthen. So it's very fascinating and a very neat technique. One of my patients recently has scoliosis. In fact, she has what's called an S-curve, where the spine is curved to one side of the body and then lower down it's curved to the other side. So it's rather complicated. And the very first thing that I did over the first 10 or 15 sessions was really work with these muscle energy techniques to relax those muscles which had gotten into short and tight and dysfunctional positions because the body had to adapt to this curved spine. After that amount of time, then I was actually able to get down to work to help straightening her spine back in order. And by the way, that's just the spine, not to mention what happens to the pelvis and the lower body too. When our bodies get into dysfunctional positions, whether it's bending over like this, what happens is the rest of our body has to compensate for that in order to keep us upright and looking forward. Another patient that I have recently had lower back pain and pain in her pelvis. And for 4 or 5 years, she had tried a number of different modalities and interventions without lasting results. So again, I started off with her with muscle energy techniques, allowing the muscles to relax and lengthen and go back into more of a normal functioning position. And then that actually allowed her body to realign itself and get back into a more normal functioning way of life. So muscle energy techniques are very effective ways and exciting ways to help muscles relax and get back into a functional position.